Hello, everyone. Thank you for being here and welcome. My name is Catherine Skolnicki, and I'm the residency manager at City of Asylum Pittsburgh, and I'm on the working group of the Onwards project. Welcome to our second workshop in our series, and this one is about understanding the U.S. healthcare and health insurance system. Last month, we hosted a workshop about the U.S. immigration system, and the recording of that is on our website, so you can find that at any time. Just a little bit about our network, if this is your first time joining us. We're a collaborative of civil society groups that support at-risk writers, artists, rights defenders, and scholars. And the purpose of this workshop is to support you once your fellowship, sponsorship, or residency is over. We know that you'll need to navigate all kinds of systems here in the US that include things like job applications, and certainly health insurance options. And so that's what today's workshop will hopefully answer some questions for you. And on our website, you can also find the rest of the workshops that we'll be offering for this year. And hopefully in the spring, those will continue. And we also have resource lists as well in the various topics of workshops that we will be offering. The first part of our workshop will be recorded, and this is going to be the informative part where our facilitators are presenting the information. And the second part is a Q&A, and that will not be recorded. At any time, if you feel like you want to take your video off or change your name, please do so if you feel that you need to do that for any security reasons. And now I will just very briefly introduce our facilitators, and then we'll start. So Renata Marinaro is the Managing Director of Health Services at the Entertainment Community Fund. She's also a trainer and arts advocate. And today she'll be talking a bit about kind of a basic introduction to the US health insurance system, explaining the variations between the different US states, and help you figure out how to find insurance where you live. After Renata's presentation, we'll have a very brief Q&A, so you can put your questions in the Q&A box or section, and I will read them. So you will not have to read your question out loud. For that 5-minute Q&A, I might take 1 or 2 questions. Then Kheir will give his presentation, and then we'll have a larger Q&A at the end. Then the second presenter is Kheir Mugwaneza. He's the program manager at the Allegheny Health Network Center for Inclusion Health. And he's going to talk a bit about how to get access to health services if you are an immigrant or refugee without insurance or with inadequate coverage. All right, and Renata?
Great, thank you very much. Let me just put my presentation up on the screen and we will get started. Hold on 1 second. All right, so thank you so much, everybody, for joining us. I know that this is a difficult topic for a lot of people. Even if you've grown up in our crazy system, it's still very confusing. So my goal is to turn you all into health insurance ninjas, basically. I really want you to understand this system, and that means starting with some basic vocabulary. Then we're going to talk about what your rights are in your situation. We're going to talk about when you can enroll in insurance, and we're going to talk about the importance of estimating your income for this system. In the second half of my presentation, I'm going to talk about some of the programs that you might be eligible for and how to understand them and how to pick plans that make sense for you and for your family. So that's really what we're going over here today. My information is for people who are under 65 years old. If you're 65 or older, that is a slightly different scenario. I'm happy to answer questions about that. But we are not going to focus on that in this presentation. So I'm just going to give you a little bit of information on the organization that I work for. It's the Entertainment Community Fund. We're a national human services organization, and we help everybody in performing arts and entertainment. We're really designed for stability and resiliency and to provide a safety net. So I don't know if you know that the writers and the actors were on strike. They resolved their strikes recently. We had a lot of people coming to us during that period of time for assistance since they weren't working. The program that I help run, the Artist Health Insurance Resource Center, it's really designed to help people understand the system and enroll in insurance and get health care if they're uninsured. So we do these online seminars with Q&A. We have what are called navigators. So we can provide one-on-one assistance to you in your situation. So if you want a free consultation and enrollment assistance, please feel free to reach out at the website that you see at the bottom, entertainmentcommunity.org/AHIRC. Our people are trained, they're unbiased, all the information is confidential, and they can set up an appointment with you and go over your situation and help you enroll in whatever makes sense for you and your family. We also advocate for legislative changes as well, because we understand that the system is not perfect. It's far from perfect, and we want to make it more consumer friendly. So I'm going to talk a little bit about the language of insurance, because it is a different language, and you need to understand these words in order to understand what you're getting yourself into, basically. So a premium is a subscription to your health insurance. So it's what you pay every month just to be able to have health insurance in this country. In other countries, they generally take it out of your paychecks, but here we don't do that. So you pay every month just to have health insurance. A deductible is what you pay up front for medical expenses before the insurance company will help you out. It's not a great system, honestly, but this is what we have. So we have many plans have deductibles. And what that means is the plan might say, okay, the first $1,000 of any medical expenses is on you. So you're paying them a monthly premium, and then you're also having to pay the first $1,000, $2,000. It varies by policy. When you look at the deductible, that means you're paying that for medical expenses before the insurance company starts to pay their share. A copay is a flat fee for a service. Once you've satisfied the deductible, then you have copays and coinsurance. Copay is a flat fee, $25 or $40. You know, if you see copay and you see the amount, that's what you're going to pay for that service when you walk in the door. Coinsurance is a percentage of the bill. This is more confusing. So if it says 20% on your summary of benefits, that's what you're paying. The insurance company would be paying 80% of the bill in that situation. So the coinsurance listed is your responsibility, your percentage of the bill. You will not have both copays and coinsurance for one benefit. You will have either a copay or coinsurance. Because you never know what you're going to pay when you go to the doctor's office in this country, coinsurance can be confusing. If you go see a doctor and you spend 10 minutes with that doctor, they're going to charge you one rate. If you spend half an hour with that doctor, they're going to charge you a different rate. Most people don't know that. So when you walk into the doctor's office, if you have coinsurance, you might know what percentage you're going to pay, but you don't know how much that's going to be until you actually get the bill. That's why copays are a better deal for consumers than coinsurance. The out-of-pocket maximum is a government-mandated number for people with health insurance. So if you have health insurance, you're not going to spend more than, I'm sorry, that should say 2023, not 2022. I don't know why that says 2022. If you have insurance, you're not going to spend more than $9,100 per person in medical expenses in a year. It's a cap. It's a stop loss. It says this and no more. You do have to continue to pay your premiums. But once you've reached $9,100 in deductibles and copays and coinsurance out of your own pocket, you don't owe anything after that. Again, this is only if you're insured and if you follow the terms of your insurance policy. So if you went to get acupuncture and acupuncture is not a covered benefit on your insurance policy, you're paying for it in full, and those costs are not going towards your out-of-pocket maximum. In-network and out-of-network relate to HMOs, EPOs, and PPOs. So insurance companies in this country contract with doctors and hospitals. And that creates what's called a network of providers. And if you have an HMO or an EPO policy, that means you can only go to those doctors and those hospitals. Let's say you have Blue Cross Blue Shield and it says HMO or EPO in the name of your policy. You know that you have to go to doctors that take Blue Cross Blue Shield, that take your policy. If you go to somebody that doesn't take whatever insurance company you've signed up with and you have an HMO or an EPO, then the insurance company is not going to cover it. You're on your own. That's why if you have an HMO or an EPO, you have to go to the insurance company's website and find out what doctors and hospitals you can go to. If you have a PPO, and it will say that in the name of your policy, then you can go see anybody. You don't have to go within a network of doctors. You will pay up front and get reimbursed a percentage of the bill. If you live in New York, you do not have the opportunity to have a PPO as a single individual, as just a normal person. You can have a PPO through your employer, through a union, but when you go on the marketplace, you will not have any PPO options. There'll be HMOs and EPOs only. The federal poverty level is what the government thinks you can live on, which is highly entertaining. There's nobody in this country that can live on this amount of money. But I bring this up because the federal poverty level determines how much of a discount you're going to get on your insurance and what you're going to be eligible for. So where your household income is in relation to this number will determine how much you pay for health insurance. If your household income is twice this number in New York State, you will get free health insurance, and it will be comprehensive. If it's more than twice this number, you're going to start paying, and the higher up it goes, the more you pay. The marketplace and the exchange are the same thing. It's a website that you go to look at what your insurance options are and to enroll in them. And the advanced premium tax credit is a discount that you get on your insurance premiums based on your income. And I will talk about that in detail at the end of this presentation. So that's our basic vocabulary. Now let's talk about what your rights are. You have the right to have health insurance in this country. That didn't used to be the case. It is now. Insurance companies cannot refuse coverage, and they cannot exclude pre-existing conditions. Pre-existing conditions are things that you had before you signed up. Heart disease, diabetes, etc. They can't exclude those anymore. There's no penalty for being uninsured in New York, but you will pay a penalty on your taxes if you're uninsured for more than 2 months in New Jersey, California, Washington, D.C., Massachusetts, Rhode Island, and Vermont. So keep that in mind. You do not want to be uninsured for more than 2 months if you live in those states. The government has decided that certain preventive screenings are life-saving and they should be free if you have insurance. These include mammograms, colonoscopies, and pap smears. So mammograms and pap smears are reproductive care for women, and colonoscopies, anybody 50 and over is supposed to have a colonoscopy every 10 years. Blood pressure, diabetes, and cholesterol tests, your COVID vaccine and your flu shots are free because of this rule. I want to point out that there's a difference between a preventive screening and a diagnostic screening. Preventive screenings are done because the Department of Health says every woman should get a mammogram every year after the age of 40. And they say every woman should have a pap smear every year after the age of 18, for example. So you're getting these, but you don't necessarily have any symptoms. That's a preventive screening. If you have a symptom of something and you go to your gynecologist and say, I found a lump in my breast, that is a diagnostic screening. It is not mandated to be free. It might be free, but it's not mandated to be free. So Medicaid is an insurance program that's a really great program, and it was expanded to include people whose income is below $20,000 a year in most states, including New York, New Jersey, California. 40 states in this country have expanded Medicaid. So that means if you make less than $20,000 a year, you're going to get free comprehensive insurance. And I'm going to talk about Medicaid in detail in the second half of the presentation. If you live in one of these states you see on the screen, unfortunately, it's going to be very hard for you to get insurance that is free and comprehensive if your income is low. I want to warn you all not to go for junk insurance. So you really want to go to the marketplace to get your insurance. You do not want to sign up for these short-term plans. There are short-term plans that are 3 months long or 6 months long. If somebody tries to sell you a plan that's less than 1 year long, it's junk insurance. And what these plans are allowed to do is they are allowed to not play by the rules that I just talked about. The rules I just talked about apply to plans that are 1 year long, and short-term plans are shorter. So a short-term plan, for example, would say, we will cover hospitalization. And then there might be a little tiny note that you can't read. And it says, but only on Tuesdays and Wednesdays. And that is not a joke. That is a short-term plan that I've seen. So you have to stay away from these short-term plans because they will try all kinds of tricks to get you to sign up with them. Faith-based share plans sound lovely. A faith-based share plan is a faith community, Christian, Muslim, Jew, whatever type of faith community, they get together, they pool their money. And if somebody in the faith community gets sick, they're supposed to pay their medical bills. That sounds great. The problem is they are completely unregulated. It's not health insurance. So they don't have to play by any rules. They don't have to cover things they don't want to cover. They don't have to cover your pre-existing conditions. They don't have to cover mental health. They can choose not to pay at all for no reason, and you would have no recourse. So it's best to stay away from these faith-based share plans because they are totally unregulated and they have gotten people into a lot of trouble, unfortunately. All right. So what is this open enrollment that you've possibly been hearing about? So open enrollment is a time every year when you can enroll in health insurance. And it's from November 1st to January 15th of every year in most states. In New York and New Jersey, it goes to January 31st. To find your state marketplace, you can go to healthcare.gov. Okay. Now, there are some other state marketplaces. New York has its own marketplace, nystateofhealth.ny.gov. New Jersey has its own, nj.gov/getcoverednj. Vermont, Massachusetts, etc. So you can either go to healthcare.gov, or if you live in one of these states, go directly to the websites that you see here. Now we are in open enrollment. It's after November 1st and it's before January 15th or January 31st, depending on the state that you're in. So we're okay. You can apply now. But what happens if you need health insurance outside of open enrollment? So you need to have one of these situations in order to sign up for insurance outside of the open enrollment period. You are either losing your union insurance, your job insurance, maybe your student insurance, or your COBRA. You're getting married or divorced. You are pregnant or having a baby. You're moving to another state or county. you have a change in immigration status. In other words, you have gone from being a non-resident to having a green card of some kind. You're turning 26 years old and aging off your parents' plan. So in these situations, you can sign up for insurance outside of open enrollment, which again is from November 1 to January 15 or January 31. You have 60 days to sign up for insurance in these situations. If you don't do it within 60 days, you'd have to wait until the following open enrollment, and you don't want to be in that situation. You can also get insurance at any time if you're eligible for Medicaid or the Essential Plan, if you want to put a kid on a child health insurance program, or if you're buying insurance for a small business. A small business is 2 or more people. So you're going to want to know what your options are, right? And what we do is we explain all your options, both public programs and private insurance. You have 4 main options. COBRA is a law that I will explain in a second that lets you keep the coverage you had through your job or union. You can buy directly from an insurance company. I never, ever recommend that because they don't care what your income is. They only want to sell you insurance, and they will sell you a policy regardless of whether you make $10,000 a year or $100,000 a year. So insurance companies will not give you a discount based on your income. The only way that you can get that discount is if you go to the marketplace or exchange. And then you might be eligible for Medicaid or the Essential Plan. If you are a documented immigrant, the first 3 options are available to you. Your eligibility for Medicaid and the Essential Plan depend on your immigration status and the state you live in, and I will go over those in detail in the second half of the presentation. So COBRA is a law that lets you keep your job or union coverage for 18 months and sometimes longer. You have 60 days to choose COBRA. However, it is very, very expensive. So it is not uncommon for a COBRA policy to be at least $1,000 a month, if not more. That would be for one person. For a family, it might be $1,800, $2,000 a month, something like that. It's very expensive. So let's talk about the marketplace. So when you go to the marketplace, right, again, the marketplace is a website that you go to figure out what your insurance options are and enroll in them. It's going to ask you for a bunch of information about your household. Your household is anybody you pay taxes with. It is not a domestic partner, and it is not a roommate, but it is your spouse, your children, etc. So they want to know the entire household income, and then they're going to tell you whether you're eligible for Medicaid or the Essential Plan, or if you're going to get a discount on your insurance based on your income. Most people are getting discounts on their insurance based on their income. So before you go to this marketplace, you should collect some information about yourself and your household. As immigrants, you're going to have to put in numbers from your immigration documentation into the application. So you should have your visa or your green card number, whatever immigration documentation you have, you should have that available. They're going to also want your income because, again, they're going to give you a discount based on your income. If you have doctors right now and you're staying local and you want to stay with those doctors, you're going to want to call them and ask them what they are in network with on the marketplace. What that means is you're asking them, what insurance companies have you contracted with on the marketplace? And the reason why you have to say on the marketplace is because insurance companies have lots of different provider networks. So one company, like, for example, Aetna or United Healthcare, could have 15 different types of doctor networks in one state. They could use a certain type of doctor and hospital network for one company and a certain type of doctor and hospital network for another company. The networks that they use on the marketplace are different than the networks they use for employers. So be specific about that. These are all the mandated benefits. So if you are getting Medicaid or the essential plan, which are free, or you're getting a qualified health plan, which will cost you money, all of these things are covered. They're not all covered for free, though. They're covered for free under Medicaid. You have co-pays for these things under the essential plan. And on qualified health plans, you may have deductibles and co-pays and co-insurance. But these categories of benefits are all required to be available to you, whether you're on Medicaid or the essential plan or a qualified health plan. All right, so we're in the middle of the presentation, and I'm going to talk about your income and how to estimate it. So by now, I think you've gotten the idea. Income is important. It determines how much I'm going to pay for health insurance. So if you're applying for coverage starting January 1st, you have to actually estimate your future income, which is really tricky, right? And so there's two ways to do this. You can look at your prior year's tax return and look at line 11. That is your adjusted gross income. That's what the government wants to understand. And so if your adjusted gross income on line 11 for 2022, if you think that that number is going to be the same in 2024, then use that number. You can use it if it's within 10%. So if it's $30,000 and you think that you're going to make $33,000, then you can use 30,000 as the number on your application. It will make it easier. However, your income in 2022 and your future income in 2024 might not be similar at all. That's the case for most people. So how do you estimate your future income in that situation? You're going to add up any W-2 income you have. A W-2 is your pay stub, right? It's when you're employed. If you have an employer and they pay you, you have income deducted for taxes. You are going to look at the gross amount, which means the total before your taxes are taken out, and you're going to put that on the application. So gross W-2 income. If you're self-employed, if you do not have an employer, but you get paid to write a manuscript, that might be, for example, you get a lump sum fee of $5,000 for something that you wrote and they have not taken taxes out. That's self-employment. You can deduct business expenses from that, okay? You can have both types of income. You can have a job and you can have self-employed work. And both of those incomes would have to go into your application. Any other type of income that you get, unemployment benefits, dividends, anything that you get, royalties, if it shows up on your tax returns, it has to be included as income in the application. The only thing you don't need to do is include cash gifts if they're under $17,000 a year. If you're in a situation where your employment is ending at the end of this year and you do not have future employment and you are going to live off of savings or credit cards or help from family and friends, you would put zero income in the application. And then when you start making money, you would go back into the application and change it. That application is fluid. You can go in and change it and update your income at any time, and it will change what you're eligible for, and it will change what you pay. So Medicaid is comprehensive health insurance. It's almost free. There are no monthly premiums. You do not have to worry about deductibles. So when you have Medicaid, the only thing that you're going to be paying is for medications. In New York, you would pay $1 or $3 for medications. Otherwise, you're not paying anything. In most states, including New York and New Jersey, you would apply through the marketplace for Medicaid. The good thing about Medicaid is it's extremely comprehensive, it's essentially free, and it is accepted by all hospitals. The problem with Medicaid is that because Medicaid pays doctors less than private insurance, it can sometimes be harder to find doctors that accept it. And it's not available to some types of immigrants. So let me talk a little bit more about that. Medicaid looks at your income, household size, and immigration status to see if you're eligible. Undocumented immigrants are not eligible for Medicaid. However, in New York, you would be eligible for emergency Medicaid if you had to go to the hospital for an emergency. Documented immigrants are eligible for Medicaid in certain states and under certain conditions. So I've listed 3 major states here. Green card holders and temporary non-immigrants are eligible for Medicaid in these 3 states if you have any of these visa types. In other states, immigrants who are qualified non-citizens, which would mean green card holders, asylum seekers, refugees, must meet a 5-year waiting period to be eligible for coverage through Medicaid or the Children's Health Insurance Program. That means that you could live in New York and be eligible for Medicaid in New York and move to another state like Texas or Georgia and no longer be eligible for Medicaid. 35 states, including New York and New Jersey, also cover lawfully present children and pregnant women before the 5-year waiting period has been met. So in New York, New Jersey, and California, you do not need to worry about this 5-year waiting period. In many other states, you do. If you're under 65 years old, in order to be eligible for Medicaid, you have to make less than $20,000 a year for one person or less than roughly $27,000 a year for 2 people. Or in the current month, your income has to be below $1,677 for one person or $2,268 for 2 people. I'm going to move on to the Essential Plan. This is a really cool plan that is available in New York and Minnesota only. Just like Medicaid, you do not have to worry about premiums or deductibles. You do have copays. So with Medicaid, I said there were only copays for drugs. With the Essential Plan, you have copays for everything, but they're fairly low. So you might pay $10 if you go see your primary care physician, $25 if you see a specialist. You know, they're low for the American healthcare system. Some dental and vision is included as well. In order to be eligible for this, you have to make less than $29,000 a year as a single person, or less than roughly $39,000, almost $40,000 a year for 2 people. You also have to be a documented immigrant in order to get on this program. Immigrants can qualify right after moving to New York as long as they have a valid visa or deferred action status. And coverage will last for 12 months. So with the Essential Plan and Medicaid, coverage lasts for 12 months, regardless of whether your income goes above the eligibility guidelines or not. If you're not eligible for Medicaid or the Essential Plan, you can always buy what's called a qualified health plan. on the marketplace, and that just means it's a private insurance product that is highly regulated. It's not junk insurance. What you pay is entirely dependent on your situation. It's dependent on your income, what type of plan you want, etc. Most people are going to be eligible for this tax credit that lowers their monthly premiums. So this tax credit is actually sent to the insurance company. If you're married, you have to file jointly to receive this tax credit. This is based on your household income estimate. So let's say you filled out the application and you said, I think I'm going to make $30,000 in 2024. And let's say you end up making $40,000. If you didn't go into the marketplace account and change your income, then the government's going to say, hey, we gave you more money than you were supposed to get. So they're going to want to take back some of that tax credit that they got, because if you make $30,000 a year, you're getting more of a tax credit than if you make $40,000 a year. It's not a penalty. It's not going to endanger anything. It's what's called a reconciliation. You will have to pay back the difference between the discount you got at $30,000 of income and the discount you should have gotten at $40,000 of income. So lesson here, if your income changes by more than, let's say, $5,000 from your estimate, you should go into your marketplace account and update your income in there. This is what the New York State website looks like. You can see what kind of a discount you're going to get. So if you live in New York County, which is Manhattan, and you make $30,000 a year, you're going to get $600 a month to lower the cost of your health insurance. What that means is most of the most basic health insurance plans are going to be free for you at that income level. A couple things to keep in mind when you're looking at health insurance. People tend to think that there are good insurance companies and there are bad insurance companies. There are no good insurance companies. They all want your money. They are designed to make money off of you. So you need to understand what your own needs are and then pick a plan based on that. The first thing you're going to do is call your doctors and ask them what they're in network with on the marketplace. Then you're going to, of course, think about your budget. And then you're going to think about how you use the healthcare system. The American healthcare system is insanely expensive. It is very common for a doctor to charge $200 for one 10-minute office visit. Lab work can be hundreds of dollars. So you're going to want to take out a piece of paper and write down how you've used the healthcare system in the last year. How many times did you go see the doctor? What kind of lab work did you get? How much do your medications cost? And I'm going to show you how to figure that out in a second. All of these things are important. Also, what's important is, do you have anything coming up? Are you pregnant? Are you going to have a baby? Are you going through chemotherapy? All of these things will determine what level of coverage you want to get. So these are the different levels of coverage on qualified health plans on the marketplace. Again, we're not talking about the essential plan or Medicaid. They are comprehensive. They don't have these levels of coverage. We're talking about qualified health plans here. So if you're not eligible for Medicaid or the essential plan, this is what you're looking at. You're looking at different levels of coverage, and the bronze is the lowest level. So what this plan does is it says you're going to pay the least amount of money every month, but it's going to be the most expensive if you need to see a doctor. So really what this is doing is saying, if something horrible happens to you, you're not going to pay more than the out-of-pocket maximum in this year. It's meant for people who never go see the doctor, don't believe in Western medicine, just want to make sure that if something horrible happens, they don't end up with a $250,000 hospital bill. That's what the bronze plan is for. The platinum plan is the opposite end of the spectrum. If you are going through cancer treatment, gonna have a baby, need a knee replacement, need a hip operation, if your medications are $6,000 a month, you're gonna want a platinum plan. They are more expensive every month, but they are cheaper when you go see the doctor. The out-of-pocket maximum on the platinum plan is much lower than on the bronze plan. Silver and gold are in the middle. So a silver plan is considered a standard middle-of-the-road plan for most people. That's what most people end up choosing. And that balances your monthly premiums with your deductibles, etc. What you want to do when you're looking at these plans is look for plans that offer you benefits that you need that are not subject to the deductible. In other words, you want to make sure if you need to go see the doctor, get some lab work done, and pick up medications, that those three things are not subject to a deductible. You don't have to worry about the deductible. That's the best way to do this. Figure out what you need and make sure that your plan covers it before you have to worry about the deductible. And always look at what's called the summary of benefits. That will tell you exactly what you have to pay. It's basically the rules and benefits of your program. So I know that Kheir is going to go over this in more detail, and I'm just going to go over this very, very briefly. But if you are undocumented, there are certain things that you're eligible for. So you can get emergency Medicaid to pay for care to treat emergency situations in a hospital emergency room. You can get prenatal coverage through the Child Health Insurance Program Unborn Child Option in states that have elected this. Private insurance companies are always happy to take anybody's money, so you can always buy a private health insurance policy at full price. And there are free and low-cost healthcare options through community health centers and hospitals. If you happen to be in New York City, there's two programs, NYC Care and HHC Options, and they will allow you to go to the hospital if you're uninsured and get care and pay based on a sliding scale based on your income. So you can only go to certain hospitals that do this. If you need to find a community health center, you can go to needymeds.org. You can also go to needymeds.org and look at pharmaceutical assistance programs. So drug companies give their drugs away for free to people who are uninsured and whose income is below a certain amount. And this is just a screenshot of the Needy Meds website. So you can go there and you can put in the name of the medication that you need, and it will tell you the name of the program, the eligibility guidelines, and you can download the application, and then you can get your medications for free from the drug company as long as you meet the guidelines. You can also see that they list medical clinics, dental clinics, mental health clinics all around the country that will see people who are uninsured on what's called a sliding scale, and that means based on your income. They'll charge you fees based on your income. One last thing, this is my last slide, and I really appreciate your attention. GoodRx.com is a great website if you have insurance or if you're uninsured and you're looking to save money on drugs. This website compares the prices at different pharmacies. So you can see Lexapro is a very common drug for depression. Target charges $61 for it normally. Walgreens charges 3 times that. And it's the same exact drug. There's no difference. So you want to shop around between different pharmacies and get the best deal. And you can get discount coupons at this website. So you can print out a coupon or you can download the app to your phone and get a discount. And this is what the discount would be. So it's definitely a lot cheaper than paying full price. And that is it. I can see we have some questions in the chat. So Catherine, hit me with them.
Great. Thank you. Renata, thank you so much. I am learning a lot and taking a lot of notes. So this is very useful information. We do have a question in the chat. The question is, what if I'm unemployed and anticipate zero income until I find a job? Will I still have to fulfill the 5-year waiting period condition before I can get the Medicaid plan?
You only have to fulfill the 5-year waiting period if you live in a state where that is the rule. In New York, New Jersey, and California, you do not have to worry about a 5-year waiting period. In states like Georgia and Texas, you do. My advice is if you're in a state that I did not mention just now, that you just Google 5-year waiting period, Medicaid, and the name of the state to see if what comes up.
Thank you. Thank you so much, Renata. If there are no more questions, well, let me just check. Oh, okay. There are no more questions in the chat right now. I will pass the mic over to Kheir Mugwaneza, who is the program manager at Allegheny Health Network's Center for Inclusion Health. And his part of the presentation is going to be about how to access health services if you are an immigrant or refugee without insurance or with inadequate coverage. So Kheir, take it away. Thank you.
All right. Thank you. Thank you, everybody. Thank you for the introduction, Kathleen. Again, my name is Kheir Mugwaneza. I'm in Pittsburgh, Pennsylvania. That's where I work. I work for Allegheny Health Network. And I also want to thank Renata for this presentation. A lot of information, but if anything, it gives you a picture of what I'm about to talk about. Some of the information there's an overlap, but it's just healthcare is not an easy access to people in the US. That's just a fact. So right now, what we're trying to do is everything that Renata talked about, some of those challenges, how do you go around those? And some of the things you shared, just knowing the resources that are available, knowing where to get medications. So let me go ahead and share my screen. All right. Okay. And I think we'll have time for more questions at the end. So this is the agenda we'll cover today. Well, we'll talk about a little bit about the introduction. We'll discuss more about the healthcare disparities, especially as they are related to the non-US citizen. That means immigrant, asylee, victim of human trafficking. We'll talk about some of those categories. Language access. That's one of my favorite topics because I've spent a lot of time working with refugee and immigrant in the past before I joined the healthcare system. So even right now at my current work, I spend a lot of time training our providers about language access. So it's very important. Then we will attempt to share some ideas and solutions how to access those services with limited coverage or with no coverage. So then I'll share some resources, just like Renata, some of the same as Renata shared, like healthcare.gov. It's a very good resource that you need to have. So that's what we'll cover. Again, thank you again for being here. And I'm looking forward to this discussion and the questions that we'll have. So first of all, let me just, again, going back to what we just talked about with Renata, her presentation. I was taking some of the notes, Renata, and some of the things that I found very, very interesting, especially, even just those terminology, understanding what does premium mean? What does deductible mean? What is copay? What is co-insurance? Some of those stuff, a lot of people, even here in the US, who are Americans, it's very, very hard. It's challenging to understand those stuff. Also, something that you mentioned, Renata, that I think I was very interesting. Some preventive screening are free if you have insurance. So that, again, to going back to health insurance and coverage and the accessing these services. So talking about healthcare access in the U.S. As a country, it's not a uniform settings. Every state is different, so it depends on where you are, your location, what kind of coverage you have, what your immigration status, and in some cases, if you have a job or you don't. So this is just to give you a broader introduction on understanding the U.S. healthcare system. We already talked about insurance. For how do healthcare providers provide those services in a culturally way? That's also important to understand. And everything that we just talked about health literacy, most of the stuff that Renata talked about, insurance, if you're not aware or if you don't know how to find that information, it's very, very confusing. So, okay. So our goals here today is to understanding those disparities as they affect non-citizens in accessing care. We'll also talk about how immigration status affect access to care. Then we'll talk about services that are available and the resources that can be used to access those services. Again, in a different angle from the previous presentation from Renata, but more to how do you access healthcare services if you don't have insurance or if you have limited insurance coverage. So the disparities that affect non-US citizens, lack of insurance, we just talked about it again. You can pay, but it's very, very expensive paying out of pocket. And that leads to limited access to insurance coverage. Again, you don't have coverage. That means you can't get the services that you need. Language interpretation and translation is a huge, huge obstacle for people who are non-US citizens. So that's something that we will talk about in more details and explaining how it's important and why it needs to be done. So I just want to share this figure, and you can see I already shared. You will have this in the resources guide, just to show you just from the accessing care, whether we're talking about primary care, whether we're talking about emergency care, or just seeing a specialist, how not having insurance or people who are non-US citizens are affected. So as you can see, people who have insurance or some coverage, they have more options. They have more options. They have where to go for those services. So the 19% of non-citizens, as you can see there, is much higher for people who don't have a place to go, for whether it's preventive care, whether it's seeing a specialist, or just going to a hospital. So that number is high. But if you look very closely at this image, you also see that at the same time, the 11% there at the bottom show that the higher number of people who end up going to the hospital, which means that usually people with less coverage, people who don't have access, they ended up needing more services, going more to the emergency and hospital. So the hospital stay tends to be much higher for that category of people who are not doing preventive care, who are not going to see their primary care. So I thought this was a good way to start and having a visual showing how access to care or lack of it affects overall non-citizens compared to other um, citizens in the US. Like I said before, language access is very important, and it's something that is a requirement from the federal government to anywhere in the US. Anybody receiving federal funding, it doesn't matter how much. And there's a Title 11, there's Section 1557 of the Affordable Care Act. Both of those, they are very, very clear at what any provider, any hospital, any healthcare provider that's receiving financial assistance from the federal government, they have to make sure that they're providing or they are making all efforts possible to make sure that people who don't speak English are getting the services they need in English, in their language of preference. So if anybody need an interpreter, a healthcare provider is required to provide those services. So this is again one of the challenges for many people who are not U.S. citizens to access services, because that communication that the providers have to have in place, it has to be clear for anybody regardless of their language, whether they speak English or not. It has to be there. So and there's a research, again, this is all in the resource page at the end of the presentation, where the research showed that limited English proficiency leads to higher risk of disparities. And there's a lot of providers out there sometimes that do not provide the services and provide interpreters in a way that's supposed to be done, even though they may have it in their policy. So that's why it's very important to make sure that you advocate for interpretation services if you need them. There are so many other things that can be done. You can ask for I speak card. You can have something in your language and in English saying that I need an interpreter. But if you go for services and they don't provide an interpreter and you feel like you need one, it's important to make sure that that's clear. They understand that's part of the services that you need. And when we talk about language access, it's not only about the spoken language. There are other people who need accommodation. Maybe somebody's blind, maybe somebody's deaf, or somebody needs American Sign Language. All that is part of making sure that we are dealing with those health disparities in a way that's more appropriate and professional to meet people where they are, and making sure that regardless of their condition, they still get the services they need. So this is more than just a language. It's more than just it can be accommodation. It can be access for people with disabilities. Again, all this information is at the Department of Health and Human Services website. I have the link at the end of the last slide that I'll share with everybody. So we talked a lot about accessing services, even from the standpoint of having health insurance and knowing the services that you need. As related to health insurance, is in the U.S. is the main determinant for how you access services, as you've seen in the previous presentation. Permanent residents, people who have green cards, compared to others, they have more options. Then Renata also mentioned about refugees. If somebody comes here with a refugee status, that 5-year period is important because that's when they become U.S. citizens. But even that the first year, they don't even have if they are refugees, they don't even have permanent residency yet. They go to permanent residency after 1 year. Now, I know there are other form of immigration, like SIV, those are different. They get permanent resident pretty quickly as soon as they get to the country. But really, the health coverage you get does affect the services that you get. And I know for some states, like in Pennsylvania, the refugees, they always have that 8-month period where they have refugee medical assistance for 8 months. But after that, it's really like you look at the options that Renata was explaining. Either you have a job or you go for private insurance. But other than that, you have to wait for 5 years to become a US. When you become a U.S. citizen, then you can be eligible for more benefit. Then I know asylum seekers, they don't get benefits till their case is approved. Then as you go, and I have a list similar to what Renata had before, but when it comes to immigration status and accessing healthcare services or health coverage, it's very complicated. It's very hard to put a limit because there are so many type of visas. And then if you are here, then something changed. Maybe you get a job. That's also something else. If you come on a student visa or visit or tourist visa, so it's very complicated to put it in one slide and explain all of it. But basically, it's knowing your own status and where to get the information that you need. I think this is very similar to the slide that Renata had of those qualified alien who are qualified to get federal and state public benefits. So we have a green card holder, again, a permanent resident, refugee asylees, Cuban, Haitian entrant, parolee, the list goes on, and this is only part of it. This is not a complete list. There are more. And like I said before, some of these visas holder or immigration status, they change after some time and you switch to another status. Like I talk about refugees and asylees because those are the ones that I worked with before. So somebody who comes here with a refugee status, after 1 year, they can get their green card. They're eligible to get their green card. Then after 5 years, they're eligible to get their citizenship. So of course, the benefit they can apply for, they change. But at the same time, the care that they can access also change accordingly. So somebody who is a refugee can come here, and after 8 months, if they don't have anything else, they don't have a coverage. They have to wait for maybe they get a job, or then when they become resident, depending on where they are, they'll look at the other options. So some ideas that I think are very important to share. If you don't have coverage or you have less coverage, again, this is really like related to my own work experience and what I see on regular basis here. Federally health qualified clinic or your neighborhood medical center, they tend to be more flexible. Let's just put it that way. Sliding fee scale, they have that. Some of them can see you and they will charge you based on your income. There are also places where people there may be free clinics depending on where you are. Again, there are places maybe that can do dental clinic. I know here in Pennsylvania, in Pittsburgh, the School of Dental at the University of Pittsburgh, they have sessions where it's students working with their professor, but they can provide free dental care to people at certain point. Knowing the community event in your at your area. Again, sometimes people have those community events where there are free medical screening, free dental and eye, blood pressure, vaccines. Those may seem very, very simple, but if you remember from Renata's presentation again, these can also be very, very expensive, even if it's just like a dental clinic. But these community events, they happen throughout the country. So knowing what's happening in your community and looking for this event can be very, very helpful. The last one I have right there is the role of nonprofit organizations and what they can do to help. But when I say nonprofit organizations, that can be really like the Refugee Resettlement Agency, organization that help with the immigration law, like application and all that. It can also be community-based organization. It can be like African Community Center. It can be Asian American Community Center, something like that in the area where you live. So, for example, here in Pittsburgh, we have the Latino Community Center. We have another organization that work with African immigrants. And those organizations, just because, for example, just because an organization is called Latino Community Center, it doesn't mean that they work only with people from certain countries. But the good thing about this organization, again, including refugee resettlement, they have that background of understanding social services that are available for people. They have that background of working with a lot of immigrant people from different status. So it's very likely that they've already worked with someone who is in your situation. So that's why sometimes, even if you're thinking about healthcare, this may not be the place that comes to your mind first, but they have those resources. They have the experience to be able to connect you to services that may be very helpful. Lastly, knowing the county or state programs. Every state is different. There are states that have programs that are geared toward helping refugee and immigrants. They have those it can be either in the governor's office or mayor's office. Those programs are very important also to know in your location to connect you to resources that you need. So the last thing I want to mention, which is very, very important, it's health literacy. And again, overall, just finding and understanding and use health services and information. Because it's been proven, again, that through research that when people understand this healthcare system, how it works, understanding healthcare insurance coverage, like as you've seen, it's a lot of information. It lowers hospital stays and emergency visit. You understand how to use your medication better. If you have a chronic condition, it helps you to understand how to manage it better. Again, this has nothing to do with your level of education or English. This is just in general. Health literacy affects everybody in this country because it's so big. There's a lot of information, where to go, how to find it. You can. I know in many countries you can pretty much go to one place and get everything done right there. It's different here. You have to know where to go. You have to know where to find the information, how to use it. It's very, very complicated. So health literacy is really, really important. That's why some of the healthcare network, like the one that I work with, they have specific programs just on healthcare literacy. So it's that important. Last but not least, I just want to share with you this. It's a lot of website resources. That's where I use the information that I just shared with everybody. And this is also where you can find some of the resources related to your city, your state. Really, I think if there's one thing that I can leave everybody with is that just get to know your local resources and find what works where you are, because it's very, very different on federal level. There are rules, there are guidelines, but some state also have some flexibility, how they provide the coverage, how you get access to your doctor and services. So thank you. That's all I have.
Thank you so much, Kheir.
Welcome.
Thank you. That was also a very informative presentation. And just, there we go. Okay. My computer screen paused for a second. Yeah. Thank you. Yeah. Thank you again, Kheir. And thank you also, Renata. I'm just remembering, Kheir, how we met, which was through the work of community-based organizations. That's how I met you first many years ago here in Pittsburgh. So thanks for being here today. And there's a question about sharing the resources that and the links that are in these presentations. Yes, all of those will be shared on our resources page. So Kheir and Renata, if you could kindly send us those parts of your presentation, we'll make sure to put that on our website as well. And I'm going to now move over to the Q&A. We do have one question in the Q&A about just how long it can take sometimes to see a doctor, or for appointments, like follow-up appointments, depending on the severity of a condition. Yeah, there can be a lot of frustration around seeing a doctor in time. So if either one of you or both of you would like to speak to that.
Yeah, I mean, I can speak to it a little bit. So it's I think in general, it's very hard to get an appointment on time when you need it. Just look for other resources, especially, but also think about your health coverage. So I don't know, Renata, like in New York, but here we have two health network, and you can either go to one or the other. You can't go to both. But if I would advise anybody, if you have an insurance that's flexible, that you can go deep, just look for other options. Other than that, usually it takes time for, depending on what you want to do to get a doctor and on time, and depending on your need. Yeah. Renata?
Yeah, I agree. It's so frustrating. I'm frustrated right now. I've been trying to get an appointment with a doctor for 4 months. So I feel your pain for sure. A couple of things that are involved in this. Sometimes it is the type of insurance that you have. So if you're on Medicaid, it can take longer to see a doctor because fewer doctors accept Medicaid. Sometimes it's just about your particular situation. If you're looking at a very rare diagnosis, for example, it can take a longer time to see a specialist that knows that field. Another thing is COVID really changed the healthcare landscape. A lot of people got out of this business, and it is unfortunately a business in this country, because it was so stressful during COVID and they were so overworked and overwhelmed. There's just a shortage of doctors at this point, and any kind of provider. In addition to what Kheir said, which I think is really good, I would say, think about urgent care facilities. If this is something that is not an emergency, then you might want to go to an urgent care center. They're often in drugstores like CVS and Walgreens. They will have a little like medical clinic in there. Or in New York, they have different names like City MD. I don't know what they are and where you are. I think you're in Denver. So, it's urgent care is usually a good way to go. You're going to want to go to an urgent care facility rather than emergency room for almost anything, because in an emergency room, you're paying for the hospital overhead. So you're paying, and it's going to be thousands of dollars. So you want to go to the ER, the emergency room, if you are hemorrhaging, if you are having a stroke, if you are in a life-threatening situation. You're going to want to go to the urgent care facility if you need to be seen right away. Maybe you have a cut that needs to be sewn up. Some urgent care facilities can do x-rays. Maybe you're wondering if you broke a bone or something like that. Urgent care places can take a look at that, and then they will tell you if you need to go to the emergency room or not.
We have another question in the chat. Let's see. This person is in a situation where they are expecting to be unemployed in the next 3 to 4 weeks without a job lined up, and they don't qualify for Medicaid because they don't have a green card. With zero income, what can be the health insurance solution for this person and their spouse? And both of them are under treatment for major health events.
I would say you should go to the marketplace. And here's a little trick. Go to the marketplace in your state, wherever you are. So you're going to start at healthcare.gov, and you're going to put the state that you live in, and it will direct you to the appropriate marketplace. You might still stay on healthcare.gov. You should list your income as just above the federal poverty level, which would be listing your household income for one person at, let's say, $15,000, or for two people at whatever that is. I'm not quite sure what that is. When you do that, it will allow you to get the biggest subsidy for your health insurance premiums. So you can get a pretty big subsidy for based on your income. And that will lower the cost of your health insurance premiums substantially. So while you may not be eligible for Medicaid, you might end up paying, and I know $100 a month is a lot of money if you are making nothing, but it might save you quite a bit of money in the long run if you have that insurance, right? So I would recommend in your situation that you reach out to our navigators. Fill out a form at entertainmentcommunity.org/AHIRC. That way we can have a private conversation with you about your situation, what state you're in, what the best options might be in your situation. And we're happy to do that. It will take us about 3 to 4 days to get back to you because we are in our busiest period right now.
Thank you. Thank you, Renata. So far, we don't have any other questions. Are there any other questions? Please feel free to write them. If not, like we mentioned earlier, all of this information will be on our website, and the video recording of Renata and Kheir's presentations will also be there. Yes, Renata?
Just want to say, somebody direct messaged me and said that it was okay to talk about their question without naming their name or anything. So somebody has a question about disabilities, about being diagnosed with a disability. So I'm just going to read it. Where does one start looking for ways to get diagnosed for disabilities? Do you go to a provider directly and request a diagnosis? Are there any disabilities that disqualify you for employment, especially in academia? Where do you look up this information? So there's a couple things that I'm hearing in this question. There's the idea of how to actually get diagnosed with something, and then there's the ramifications of it. How does it affect you in your work life, et cetera, right? So it totally depends on the type of disability that you're concerned about. If it's a mental health disability, if it's depression or something like that, you're going to be going to a psychologist, a psychiatrist, or a social worker. If it's neurological, autism, something like that, you're going to be going to a neurologist as well as probably a psychologist. If it's orthopedic, having to do with your body structure, you're going to be going to an orthopedist. So they will determine what the diagnosis is. A diagnosis has to be determined by doctors. And in this country, it's generally done by specialists. So you might go to your primary care physician to start, And then they will say, okay, we're concerned about this. You should go see this specialist and see what they say. Once you're diagnosed with something, whether you're considered disabled or not, has to do with how it impacts your functioning. So if you are unable to function, you are absolutely unable to do any work at all, then you would likely be deemed disabled by the Social Security Administration. Whether they give you any money for that or not depends on how long you've been in this country, what your immigration status is, etc. There are two different types of disability programs through the Social Security Administration. One is known as SSI and one is known as SSDI. So the Social Security Administration determines if you're disabled and unable to work, essentially. And I hope that's helpful.
Any other questions? Well, if that's the case, then I would just like to thank Renata and Kheir again so much for all the information that you've shared. And I'm really glad that we've been able to host this meeting. Not only those who are present today will be able to benefit from the information, but also everyone who will see this in the future as well. So yeah, we're very grateful for your time today. And thanks to everyone who showed up.
Thank you, everybody.
Thank you. Bye.